Hi, Jasmine. Can you hear me okay? We're just going to wait a minute or so just for more people to get on. Can anybody confirm that they can hear me before we get started? Lovely, thank you. Dr. Slater should be out here in just a moment. You guys just want to come sit over here?
All right, well, welcome to our first White Coat Wednesday at ICRM, the Idaho Center for Reproductive Medicine, which is an acronym, and it just so happens that today we are going to talk about acronyms. I think everyone's probably noticed that we're utilizing acronyms more in this world, and it's not just in the fertility clinic. However, the fertility clinic, we use a lot of acronyms, but I think just universally this is happening, and most likely because the world is becoming more specialized and subspecialized, and we're texting, we're emailing more, so it makes sense. So today we're going to talk about acronyms. If anyone has questions, they can always message them if they want more elaboration on the acronyms, or if there's an acronym that we missed. I was just going to go through some of the more common ones that you may see in your chart. Of course, there's many more acronyms that you may have used without, being in the medical profession. So we'll go through the most common ones, and if you have any questions, please don't hesitate to message. So we'll go in alphabetical order. And my name is Kristen Slater, one of the physicians at the Idaho Center for Reproductive Medicine. And Haley, want to introduce yourself?
I'm Haley. I'm a medical assistant here. I actually work alongside with Dr. Slater every day.
Yeah, so we're here to teach you, and if you have any questions, we know it's a lot to go through, but we're always here to teach you and walk you through the process. So we'll start with A's. AMH, anti-Müllerian hormone. This is the hormone that measures egg reserve, so it measures egg quantity, not egg quality. And typically, with an AMH, less than 1 is low egg reserve, 1 to 3 is normal, and then greater than 3 is a high egg reserve. So we use that as a surrogate marker for egg reserve. And we have another surrogate marker for egg reserve, AFC, antral follicle count. So when we do an ultrasound, we look at the follicles on the ovary, and the follicles are the homes for the eggs. And we're looking to see how many follicles we can count. Typically 5 to 10 is what we would see per ovary, but the more the merrier. AH is assisted hatching. So when we have an embryo, it has its outer shell, and we'll put a little nick on the outer shell to help it so it can hatch out of its shell for implantation. AMA, advanced maternal age, probably not everyone's favorite one. I don't like this one. So women that are above 35 are considered AMA, but that's only, we're still young at heart above 35, but it's just that our ovaries have the lifespan of to age 51 when menopause occurs, but our heart and our brains can live to over 80, but this is just a medical term for over 35. ART is advanced reproductive technology. So this is technology where you're fertilizing outside of the body and getting pregnant in that way. So something like an in vitro fertilization cycle, which is IVF, or a frozen embryo transfer cycle is FET. Those would all be under ART. Beta-8-CG, so beta human chorionic gonadotropin. This is a hormone of pregnancy. So this is a hormone that the pregnancy tissue secretes that will check the blood to see if there is a positive pregnancy test. CD1, cycle day 1. So that is the first day of your period. ED, we use this for embryo donation. So when couples are done with their family building, they have excess embryos, often that they'll want to donate to the clinic that we can donate anonymously or non-anonymously to other couples. And it's a wonderful way for family building and utilization of life. Sometimes people will use the acronym ED for egg donation. Typically we'll use OD, ovum donation. Ovum is more Latin for egg. So that may be interchangeable, but for the most part in our clinic we'll use ED for embryo donation and OD for ovum donation. EDC, estimate date of confinement. So that's your due date. That's a happy date. ER is egg retrieval. So that's the process when we take the eggs out transvaginally under ultrasound guidance. Now, if you were in the hospital and you said ER, they would think that's emergency room. But if you're in our clinic, it's egg retrieval. So ERA, endometrial receptivity assay. This is an assay where we biopsy the tissue from the uterus to see if the window of implantation is correct timing from progesterone to implantation, or if we need to personalize that window and adjust the timing from progesterone start to implantation with the frozen embryo transfer. ET is embryo transfer. That's when we put the embryos into the uterus after in vitro fertilization. E2 is estradiol. So we use this. This is a hormone that we're checking when you're going through in vitro fertilization. When the follicles, they make estrogen, which is E2 is the estrogen that we're checking. So that's the hormone that we're checking to see, are these follicles making the correct amount of hormone that they should. EV, estradiol valerate. When you're doing a frozen embryo transfer, you take a form of estrogen to proliferate the uterine lining, and this estradiol valerate comes, it's an injectable form. So this is just one form of estrogen. FET, frozen embryo transfer. So after the embryos are made and they're cryopreserved, then we'll put the embryos into the uterus on a frozen embryo transfer, which is where we take estrogen, the EV, for 2 to 3 weeks. We start progesterone, and then typically on the 6th day of progesterone, we would do the ET, the embryo transfer. FSH, so follicle stimulating hormone. This is one of the hormones that comes from the pituitary gland, and it stimulates the follicles. It does exactly what its name says, follicle stimulating hormone. So it stimulates the follicles to grow, and the follicles are the homes for the eggs. GC is gestational carrier. So when someone carries a pregnancy that is not genetically related to them, they are a gestational carrier. This, and also I've seen GC as a genetic counselor, but more commonly GC is gestational carrier. HGH, so human growth hormone. Sometimes people will have this on their stimulation grid as one of their medications. So human growth hormone, we're using it as an off-label use as an adjunct, and there are many reports that do show that the HGH, the human growth hormone, can improve embryo quality. So sometimes that's added to an IVF stimulation protocol. HSG, histosalpingogram. This is a dye test where we put dye into the uterus and take an x-ray to see if the inside of the uterus is a normal cavity, that there's not any polyps or fibroids, and to see if there's bilateral tubal patency, if both tubes are open. IC, so this is intercourse.
Ooh, sorry guys, stuck.
ICSI is intracytoplasmic sperm injection. So with in vitro, when we take the eggs out of the body, We typically, with standard fertilization, will put 100,000 sperm per egg in very close proximity. If we have lower sperm counts, or we're using frozen eggs or frozen sperm, we'll do the ICSI, where we inject the sperm into the egg. So it stands for intracytoplasmic sperm injection. It's a way of fertilization. IUI is intrauterine insemination. A lot of times people get IUI mixed up with IVF, like what's the different treatment plan, but IUI is you're fertilizing inside of the body, and with IVF you're actually taking the eggs out of the body and you're fertilizing outside of the body. So with IUI, when women are ovulating, their partners would collect sperm, or donor sperm, and we would centrifuge and process the sperm and get a pellet of highly concentrated motile sperm and give that sperm a boost closer to the eggs. IVF, so in vitro fertilization. This is where women will take the fertility medicine and then we'll harvest the eggs, and then we will fertilize the eggs outside of the body, culture the embryos, and put 1 or 2 embryos back in at a time. LH, luteinizing hormone. This is a hormone that comes from the pituitary gland also, and when women have their ovulation surge, sometimes you'll pick up an ovulation surge in the urine, ovulation picture kits, then it's because of this LH hormone reaches a threshold that causes the body to ovulate. LMP, last menstrual period, so that would be the first day of your last menstrual period. OCP is oral contraceptive pills or birth control pills. We'll use this often in preparation for in vitro cycle, just to keep the ovaries in a holding pattern and for cycle control with timing. OHSS, ovarian hyperstimulation syndrome. We don't see this very often anymore. We see it quite a bit, but now there's new medications to stimulate the ovaries so that we don't have as high risk of ovarian hyperstimulation syndrome. When women make many eggs and they have high estrogen levels, the ovaries can swell, and if they get too high of levels, with ovarian hyperstimulation syndrome, the symptoms would be very abdominal distension. So it takes a week or 2 for the hormones to go down and the ovaries to go back down to normal size. Often women will have severe bloating, distension, and it's a hyponatremic, so low sodium, hypovolemic, low volume status. So the treatment for this is high fluid intake and high sodium fluids. And the good news is it typically resolves after a week. And we don't see that often anymore because we've got better medication that can prevent this syndrome. OPK, that's the ovulation picture kit, so that's what you're checking to see when your LH surge is. Polycystic ovarian syndrome, PCOS. So this is a syndrome, and truly to have this syndrome, it's just 2 things. You have to have irregular periods and either high androgens or high androgen symptoms. PGT, pre-implantation genetic testing. So when embryos are created with in vitro fertilization, we can biopsy the embryos to see, is this embryo 23 chromosome competent, or we can biopsy it to make sure it doesn't have disease. So that's what the PGT, it's pre-genetic testing. We're testing the embryo, at the embryo stage before it's a fetus. PIO, progesterone oil, that's just a form of progesterone that women will take in their frozen embryo transfer stimulation protocol. POI, so premature ovarian insufficiency. If women have prematurely lost of decreased ovarian reserve, this is a term for that. P4 is just an acronym for progesterone. So progesterone is the hormone, is progestation, so it's pre-pregnancy, it really promotes pregnancy. And it's a hormone that comes from the follicle after you ovulate that stabilizes the lining for pregnancy to occur in implantation. So it's a good hormone for pregnancy. REI is reproductive endocrinology and fertility. That's a specialty that we're in, so it really deals with the science of fertility. RPL is recurrent pregnancy loss. If you've had 2 or more consecutive miscarriages, that would be considered RPL, recurrent pregnancy loss. Semen SA is for semen analysis. This is a way to look at male fertility potential, and basically we're looking at the concentration and the motility of the sperm and the ejaculate. SAB, so spontaneous abortion, is another term for miscarriage. SD1, stim day 1. So stim day 1 is the first day that you're taking your medication, whereas CD1 is cycle day 1, the first day of your period. SIS is saline infusion sonogram. So this is when we put water in the uterus to make sure there's not a polyp or fibroid or any organic lesion in the uterus that would interfere with getting pregnant or cause miscarriage. TVUS, transvaginal ultrasound. So this is just the best way to look at the ovaries and the follicles. So when you're going through fertility and medication, typically you'll have a transvaginal ultrasound so we can measure the follicle growth, the homes for the eggs, so when the eggs are mature. UPT is urine pregnancy test. And US is ultrasound. So you can see there's lots of acronyms, and I'm sure there's more. If anyone has questions, we can always discuss any other acronyms. But we're happy to teach you today, and we'll be doing the White Coat Wednesday because we're happy to talk about fertility topics every first Wednesday of the month. And then next in August, it'll be August 4th, will be Dr. Tobler discussing RPL, recurrent pregnancy loss. Thank you.